It's a typical day for about 500,000 school-age youth in Connecticut. But for the 160,000 that suffer from a diagnosable mental health or substance abuse disorder, their school day could be much different. Here's some numbers to think about. 160,000. That's 20% of children that may meet criteria for a mental health diagnosis. And, left untreated, can lead to behaviors that end in arrest. Exclusionary discipline practices like suspension, expulsion, and arrest result in less time spent in the classroom, leading to academic problems and maybe even dropping out of school. School arrest, expulsion, and suspension disproportionately affects students of color and students with disabilities. Students that are arrested are 2 times as likely not to graduate, and if they're processed through the court system, that increases to 4 times. For some of these students, this road leads to the juvenile justice system. It doesn't have to be like this. The Connecticut School-Based Diversion Initiative, SBDI, is a school-level program that promotes positive outcomes for youth at risk of arrest due to emotional or behavioral health challenges. It works by linking students to community-based services and supports, professional development sessions for school staff, a review of the school's discipline policy, and other arrest reduction efforts. Class dismissed. The SBDI road leads to improved outcomes and promotes connections to the behavioral health system, with many supports and services along the way, including mobile crisis intervention services, youth service bureaus, the Juvenile Review Board, and through innovative approaches like restorative practices and the graduated response model. School personnel respond differently to behavioral incidents. Students receive better support from school teachers and administrators, school resource officers, and families. The most important part of all this are the outcomes for our kids. Students remain in school and in class. School climate is improved. Graduation rates go up. It's cost effective. It strengthens the connection to home, school, and the community. Expulsions and suspensions are dropping. Arrests are down and rearrests are reduced. School staff report better awareness of community resources, resulting in better referrals for families. The SBDI toolkit is helping schools get started, reducing arrests, suspensions, and improving service coordination. Schools that have participated in SBDI since 2010 on average have reduced court referrals by 45% in their first year of participation, and have increased EMPS referrals by 94%. This multi-level approach, including policy, systems coordination, and intensive in-school efforts, is the most effective approach for diverting the pathway between school and the juvenile justice system. To learn more about SBDI, check out our website at ctsbdi.org. See you in class!